skin if they're uncircumcised. Start at the tip of the penis using a circular motion working down to the base of the groin and out to the thighs. If they were uncircumcised, rinse, pat dry, and make sure you pull the skin back up over the head of the penis. Next procedure, back rub. What is the position of the bed for a back rub? Up at your waist, so you want it at a workable height. What kind of strokes are used up the spine? Long, firm strokes, so straight up. What kind of strokes are used on the shoulders and upper arms? Circular strokes on upper arms and back down to the spine. How long should a back rub last? About 3 to 5 minutes. And what is done with the excess lotion? You pat it off with a towel. We don't want any extra moisture on their skin. Next procedure, bed shampoo. What should dirty water flowing out of the shampoo basin during a bed shampoo be collected in? You place the basin on a chair to catch the water flowing from the shampoo basin. And what position should the resident be placed in for this procedure? Supine position, so the water doesn't run off onto the bed. Next procedure, oral care for an alert and oriented resident. Which teeth are brushed first for an alert and oriented resident? The top teeth first. Why? It reduces the amount of saliva collected in the lower part of the mouth. What areas are checked during this procedure? TMTL, teeth, mouth, tongue, and lips. And what are we checking these areas for? Bleeding, discoloration, sores, odor, cracked teeth, or loose teeth. Next procedure, oral care for an unconscious resident. What position should an unconscious resident be in when performing oral care? Lateral position. We don't want fluids running down the back of their throat. How often are the swabs changed during oral care for an unconscious resident? After each wipe. So, one time use and get a new one. What areas are you checking during this procedure? Teeth, mouth, tongue, and lips. And what are we checking them for? Cracks, sores, odor, bleeding, discoloration, or loose teeth. What do you want to do to their lips for comfort? Apply lip balm or chapstick, lip moisturizer. Next procedure, denture care. How are the upper dentures removed? You rock the uppers up and down. How are the lower dentures removed? You turn or roll them side to side. What is done to the sink to protect these dentures while brushing them? Place a towel in the sink and fill it halfway full with warm water. What areas are we checking when we're doing denture care? we checking it for? Cracks, sores, odor, bleeding, discoloration, loose teeth. And if they do not want them back in their mouth, what temperature of water should you store them in? Cool water. Cool water. Next procedure, electric razor. What are the things we cannot use an electric razor around? POW, P-O-W, pacemaker, oxygen, and water. Describe the motions you make when using the electric razor. You shave in the direction that the razor is shaped. So if it's a circular headed razor, hold the skin tight, shave in a circular motion. If it's a foil razor, which kind of looks like a square, you shave in the direction that the hair is growing. Next procedure, safety razor. How is the beard and hair softened in order to use that safety razor? First, we moisten it with a warm washcloth, then spread shaving cream over the area. How is the face shaved with a safety razor? Downward strokes. How is the neck shaved with this razor? Upward strokes. And what do you do with the razor when you're finished? Put it in the sharps container or a needle box. Next procedure, combing and brushing hair. How do we comb their hair? Divide the hair into small sections, starting at the bottom, working down to the scalp. So downward motion at the ends of the hair, working up to the scalp. How do we protect their bedding or clothing while doing this procedure? Place a towel. So place a towel over the pillow or a towel over their shoulders. And what is offered to the resident after combing their hair? We offer them a mirror because they decide how they want their hair to be styled. Next procedure, fingernail care. What are the fingers and nails checked for before you start this procedure? We're checking for color, swelling, cuts, splits, heat, and cold. What order is the following equipment used? We have a nail file, we have clippers, and we have an orange stick. So what order do we use those in? First, we use the orange stick to clean under the nails. Next, we use the clippers to clip them straight across. Then last, we use a file to round the curves. What do you do for yourself during fingernail care? Wear your gloves. Next procedure, foot care. What should be placed on the floor under the basin for the foot care? A towel. How long should you soak the feet? 5 to 10 minutes. What do you do for yourself? Wear gloves. And where should you not apply lotion? Between the toes, because that's a friction area and can cause skin breakdown. Next procedure, changing the residence gown. How do you provide privacy while you're changing the residence gown? Pull the top sheet up over their chest. What side is dressed first? The affected side. And what side is undressed first? The good side. Next procedure, dressing a dependent resident. How can privacy be provided while dressing the dependent resident? Drape them with a bath blanket or a towel or a regular blanket. Just drape them, keep them covered. What item of clothing goes on first? Pants first, affected side first. When you're assisting to the bathroom, during assist to bathroom, what should be left with the resident if they're safe? Call light and toilet paper. When you're wiping a resident, what direction do you wipe in the front? Down. And what direction do you wipe in the back? Up. What should be done prior to pulling up the resident's pants? Take off your gloves and wash your hands. And what is the last thing that is done before letting the resident leave the restroom? Have them wash their hands. So gloves off, wash your hands, raise their pants, then assist them to wash their hands. Next procedure, bedside commode. Where is the bedside commode placed? Just like transfer to chair, on their strong side, touching the bed frame. When the resident has finished, what do you do with the urine and feces prior to disposal? We check for coca, color, odor, characteristics, and amount. There's something wrong, leave it for the nurse to check, and if everything's okay, clean it to company or facility policy. Next procedure, bedpan fracture pan. What position is the resident placed in when putting them on